Hello friends, I'm Jyoti Hikar and today I'm going to talk about the introduction to a medical coding. So let's start. In this, the firstly we see the introduction. In introduction, the medical coding is defined as the transformation of healthcare diagnosis and procedures or medical services and equipments into a universal medical alphanumeric codes. It is a standardize the language and the presentation of all these elements so they can be easily understood, tracked, and modified. It is performed all over the world with most countries using IST. So let's see the importance of the medical coding. In that we see the collection of a general medical statistical data, then medical reimbursement, and then hospital payment, quality review, benchmarking measurement. These are all the importance of the medical coding. Then we go forward to the brief history. In history, it originates in England during the 17th century. Statistical data was collected from the system called the London Bills of Mortality, and the data was organized into a numerical codes. The codes were then used to estimate the most recurrent causes of death. Then the statistical examination of the mortality rate was organized into the international list of the cause of death. Then the WHO used this list in a tracking in the morbidity rates and the international health developments. Then the list was later developed into the International Classification of Disease. Its 10th edition is ICD-10-CM. In 1997, the global medical community accepted the ICD system, which compelled the NCHS to extend the ICD by including the causes of a death and clinical diagnosis. So this way to catalog the medical records make the medical evaluation quick and easier. Then we go forward to the ICD. ICD, it stands for International Classification of Disease. This code was established by WHO in late 1940s. Then these are diagnostic codes that create the uniform vocabulary for describing the causes of the injury, illness, and death. Then it has been updated to the several times since its inceptions. For example, ICD-10-CM, the code that is currently in use in the United States is ICD-10-CM. This means it's the 10th version of the ICD code. Then the CM at the end stands for the clinical modification. Then ICD codes are used to represent a doctor's diagnosis and the patient conditions. In the billing process, these codes are used to determine the medical necessities. Then we go forward to the CPT. CPT stands for current procedural terminology. In that the CPT is used to document the majority of the medical procedures performed in a physician's office, published and maintained by American Medical Association, that is AMA. Then CPT codes are 5-digit numeric codes that are divided into three categories, which are category 1, category 2, and category 3. In category 1, it is used most often and divided into six ranges that corresponds to the six major medical fields. Then in second category, it corresponds to the performance measurement laboratory or radiology test results. Then in third category, it corresponds to the emerging medical technology. Then we go forward to HCPCS, that is a Healthcare Common Procedure Coding System. It is developed by a CMS, that is the Center for Medicine and Medicaid Services, and it is maintained by American Association. It corresponds to the services, procedures, and equipments not covered by a CPT. It is the official code set for the outpatient hospital care, chemotherapy drugs, and among the other services. SCPCS code sets are divided into two levels, level 1 and level 2. In level 1, it is identical to CPT, and in level 2, it is a set of alphanumeric codes that is divided into a 15th section, each based on the area of specificity like medical and laboratory rehabilitative services. Then we go forward to the basic steps in coding. That is, first step is review the health records, then identify the principal diagnosis and procedure to be coded, then identify the main terms in alphabetic index, then review any subterms under the main term in the index, then follow any cross reference instructions such as see also, then verify in the tubular list and the code selected from the index, then refer to any instructional notation in the tubular column, then assign a codes to the highest level of specificity, and then the last one is assign the codes to the diagnosis procedures, reporting all the applicable codes and sequences in the accordance with the guideline. It is all about the introduction of medical coding. Thank you.